so-called liberation therapy for patients with multiple sclerosis has stirred up a lot of debate in Saskatchewan. It's not available here, so people have traveled far and wide to seek out the treatment. There are some doctors who support it and some who don't. Dr. Bill Code is an anesthesiologist. He has MS, and he's had the neck vein therapy. He joins me now in our Saskatoon studio. Hello, Dr. Code.
Good afternoon.
So when did you have the treatment?
I had it the 29th of November, so just under 3 months ago.
And how's it gone for you?
Well, it's gone extremely well. I mean, I decided over a long period of time, looking at things, looking at options, and then I was really, I think, fortunate to hear a fellow speak. I was on a panel with him in mid-November in Vancouver, and he talked about, they not only did the procedure, but they did the tough ones, the redos, the people that had trouble with their stints, or maybe the people that were undertreated, because the thing that's happened in the last 6 months is now we're much more aware how to do it optimally, I believe.
And when you were going through the process of deciding whether or not you were going to do this, what went through your mind?
Well, I think that the main thing that went through my mind was, did I have the variation in veins that were the case? And also, I was not overly worried about the issue of clotting, because I know that this is working in the veins as opposed in the arteries, and that's why it's a much, much less risk of a stroke than some of my colleagues worry about. Because if there's a small clot in the vein, then it goes to the heart and goes out to the lungs, and they deal with it. It's only the very large clots from the pelvis and the leg veins that become an issue as far as so-called pulmonary embolus. So I was not worried about that issue. I was fairly hopeful that I would not need a stent. In fact, even in the last 6 weeks, the people that I go to that use this so-called expansion of the valves or disruption of the valves of the jugular veins now are virtually never putting in stents in the jugular veins, for the simple reason that in many cases those small narrowings which we used to treat upstream, they resolve over a period of days or weeks once you open up the valves.
So, what was the point when you decided, now I'm going to get this done?
Well, I was tentative, and then when I heard the fellow speak, Dr. Joseph Hewitt, who actually grew up in Manitoba, interestingly enough, he's a Canadian citizen, even though he works in California. When he spoke, he said there was 3 key things that he'd seen dramatically improve. One was headaches, especially wakening headaches. A second was sleep disturbance, and the third was fatigue. And I had all 3, and I felt if I even got one better, I'd be all over it. So I decided I was in that night and paid my deposit the next day.
Okay. And so then how are you feeling now versus how you were feeling before?
Well, I did get those 3 benefits they talked about. There's no question. I virtually don't have headaches now. I mean, I can still get one if I over-imbibe red wine, but the regular headaches are virtually gone, and that's a tremendous relief also for my liver and kidneys, because I used to use a tremendous amount of Tylenol and ibuprofen to solve that. The other part was my sleep disturbance, is much, much better. So I wake up much more rested. I'm a morning person again for the first time in probably 15 years, since my diagnosis. And then the third one is the fatigue. My stamina is incredibly better. But the other benefit, which I wasn't necessarily expecting but hoping for, was the reduction in cognitive challenges or brain fog. That's hugely better. So to have more stamina and a clearer mind is a wonderful thing at the tender age of 57. And then the unexpected bonus, since then we've discovered that almost everyone gets autonomic benefits as well. That means improved bowel and bladder control. And so to have my bladder like it was 30 years ago, I'm really happy about that.
So now, as you were deciding whether to get this or not, were you worried about whether or not there was enough medical evidence to prove whether this works or not?
Well, I wasn't, because, there's now 12,500 people have had this procedure. I've them, and I've met them online, through Facebook, and in person. Some of them who I very highly regard. I've seen it help people that can no longer swallow. That's better. One of my very good friends that I work with often, she's only had it a month ago. She is now hugely better balanced. She's able to be much more mobile. Her husband describes it well. You only walk like a 2-martini person now instead of a 6-martini person. So I have seen enough evidence of it. I know that isn't placebo. You can't solve people's bladder problems with placebo and all these other sorts of things. So I'm convinced. And, if we look at it as an improvement in quality of life or symptom control, much like we used to look at angina. I mean, we did coronary artery bypass grafting for 30 years before we found the subset that had actually improved the length of their life. So I think it's going to serve us much better in the short term to think of this as a symptom control, get people their human dignity back as far as bowel and bladder control, and maybe help them, better at their balance, walking, even dressing, and simple things like that. So that's why I don't have any qualms about doing it or suggesting it to people.
Mm-hmm. And we've certainly heard many stories like yours and from many people in Saskatchewan. Do you think there needs to be some sort of medical documenting of this, of the difference or what it apparently does for people? Or why do you think that there's still, among some in the medical community, there's still this question in their minds as to whether this is effective?
Well, it's much safer. So the next thing we should be doing in Canada, and I think Saskatchewan's at the forefront of this. I was lucky enough today in Saskatoon to visit the Chemical MS Neuroscience Research Center. I mean, things are really moving ahead here. We, with a basic science chair as well as a clinical chair in MS research. So I think it is time, because other parts of the world are now doing clinical trials, meaning they're doing the procedure. They're doing the procedure in a clinical trial of roughly 1,000 in Albany, New York, another 1,000 in Buffalo, New York, and Dr. Zamboni has got a series of centers in Italy starting. So I think it would be really inspirational for Saskatchewan and also other Canadian citizens, if a pilot trial was started here, and not only that, it gains information, then you can expand it to other pieces, but it would show that, we're really serious, and because I personally believe we have enough evidence to go ahead and start to do a clinical trial with all the regular requirements of investigation review board or ethics review and so on.
Dr. Code, thanks so much for joining us today.
Thanks very much.
Bye-bye. Dr. Bill Code is an anesthesiologist. He's giving a free public lecture on neck vein therapy for multiple sclerosis at the Avalon Alliance Church in Saskatoon tonight. It starts at 7.